And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
This is BoomerLife on CIL 650. Hello, I'm George Gordon, and on BoomerLife today, we are joined by the professionals at Integrative Naturopathic Medical Center in Vancouver, and today we are going to be talking about weight management. In studio with us, naturopathic physician Dr. Katie Leah and Kirsten McEwen, registered holistic nutritionist. Katie, Kirsten, welcome to BoomerLife.
Thank you.
All right, let's find out a little bit more about you folks and how you got involved in this and why you're such great believers and why you're making believers out of so many other. Let's start with Katie.
Well, to let you know a little bit about me and my practice, I actually started off at Integrative as a patient of Dr. Eric Posen, who's one of our founders. And, my parents took me to Integrative as a young child. And from that, I was really just exposed to the naturopathic lifestyle. And now I have a general family practice there. I see, lots of hormones, lots of weight management, lots of things like food allergy and sensitivity. And I've really been able to work really closely with Kirsten in just, sort of helping people enjoy a healthier lifestyle.
That's you touched on so many points, and we'll be dealing with them over the course of the show. Things that you may not even know that are affecting your health and that can be helped with naturopathic cleanses and so on. We've got so much to talk about today. But let's talk to Kirsten, get your background.
So I am a registered holistic nutritionist and a graduate of the Canadian School of Natural Nutrition, which is actually, we have a branch here in Vancouver, and I'm now an instructor there as well. I kind of got into this industry about 10 years ago after struggling with some health issues of my own that were really helped with change in my diet, nutrition, lifestyle, and I decided, hey, maybe I could make a career out of this. So I actually went back to school and got into the field of holistic nutrition. So I have a special interest in weight management, of course, that's sort of what we're here for today, but also stress management and hormone balance, all of which do tie into weight management. And I always say that my sort of specialty is providing really simple solutions for people who have kind of busy lifestyles who, finding solutions that fit into where the person's at today instead of, overhauling the whole lifestyle.
I think it is so important because I may be a couple of years older than you two put together. But I can remember going back to the early days of going to the doctor and talk about naturopathic or holistic medicine was taboo because allopathic doctors were taught a very strict regimen. But that's changing, isn't it? That you not only do you understand and espouse to people that they can work together, but the doctors, the allopathic doctors, are now seeing the benefits too.
Absolutely. And in our clinic, we're really fortunate that we are able to, dovetail what we do with conventional medical practitioners as well. So, there's no sort of one size fits all. And, a lot of people that we see we're encouraging to see their allopathic doctor, but to also come to us for, some of those things that are just a little bit outside of the scope of their medical doctor.
Boy, I would think that if the patient or client, whichever whichever office you refer to them in, would see some great benefits, would have much more trust in professionals who trust each other.
Absolutely.
Yeah.
And I think it's important at Integrative, we don't want our clients and patients to feel like they have to choose. So you can see your allopathic or GP and also come to see the practitioners at Integrative as well.
Let's talk then about weight management, something our listeners probably think about every day. Maybe when they look in the mirror, maybe when they stand on the scales, maybe in just how they feel. That desire, though, to lead a healthier lifestyle is something we talk about regularly here on BoomerLife. However, speaking to it and actually living a healthier lifestyle is a lot easier said than done. The stats don't lie. Obesity is on the rise in Canada. Carrying around excess weight cannot be healthy for us. We know that. We know that weight management can be frustrating with so many contradictory programs and products are available. It can be hard to know who to trust. Lack of immediate results can be discouraging. Many turn to fad diets and quick fixes. how much of this have you seen in your practice?
Well, we see it all the time, and that's something that we're really trying to encourage people to make more sustainable, long-term changes when it comes to weight management. Everybody has tried a quick diet, has seen some success, but ultimately we're looking at things for a more long-term solution.
Let's take a look at just the basic overall idea of the weight management program at Integrative Naturopathic Medical Center. If I'm coming in, and I, again, refer to myself as being a little older than you, or a lot older, but I guess people from all ages come in. Does everybody have their own sort of plan set out by you folks?
Absolutely. So definitely we see all different types of people in the weight management program from, in their 20s all the way through to their 60s, 70s, and 80s. So definitely there's something for everyone there. But what we do is we combine dietary change, of course, and that's going to look different from person to person. With lifestyle change, so things like stress management, physical activity, and then also some little boosts that we add in. So things like metabolic injections and supplements, which we find just kind of help things along a little bit more quickly.
And are there commonalities? Say a young person coming in would one 20-year-old be much the same as another 20-year-old? A 60-year-old, do they have the same problems, or is everybody really different?
I mean, from our perspective, everybody is a very unique individual and has a unique set of factors. Their genetics, their lifestyle, their diet, pre-existing health conditions, and those are things that we really try to take into account because, from our perspective, we're really trying to create an individualized plan, and we found that just works. We're just much more successful when we tailor it to the individual. So absolutely, from person to person, we always need to be adjusting based on their specific needs.
We've talked about the plan. How important is it to have a plan as opposed to say, you know what, you need to say cut back on this or have a little more of that? I mean, a plan is not just for the next day. The plan is for over a period of time.
I think it's essential, personally. I think, everyone has the best of intentions. Everyone knows that they should be eating better or moving more or whatever it might be. But they're not exactly sure what that looks like. So I think having a plan is essential in long-term success. Once you kind of know what the plan is, I think it's much easier to be successful, follow through, and see results as well.
I suppose if you can't measure it, you can't manage it. This lays out some guide paths. Now, is there a danger there for people? Here's the plan. Here's your plan. What happens when they sort of hit a plateau or something doesn't start to happen? Is there counseling? Do you sort of coach them along and just say, look, you know what, it'll come along?
Absolutely. So we build structure and accountability into our weight management plan. So for a lot of people, especially initially, they're going to be meeting with us on a weekly basis. So we talk about, for last week, what worked, what didn't work, what does the coming week look like, and how we can be more successful in the coming week. So it's just kind of constantly evolving and constantly changing based on how they're feeling about things and what their results are like as well.
The nice thing, too, is we have a lot of tools available. As we find people, they start to get better or they plateau a little bit, we can always reevaluate and try something different. So we've definitely got a really, really big toolkit available to us. And then we also have an opportunity to start looking at reasons why things might not be working anymore. Or is there something else going on that we didn't pick up initially or that we haven't talked about or we haven't investigated? So we definitely have a lot of options available.
And we want to remind you just at this point, if you're looking for more information at any time, you can go to integrative.ca. You'll get lots of answers there, contact points, numbers, and all that. And that's integrative.ca. Or if you throw it into Google, they're usually pretty good about spelling things much easier for it. Let's talk about some of the things that are aided by the plan for weight management. If a healthy body is a healthy mind, just run through some of the things that can, where the individual can benefit by having that weight management program in place.
Well, definitely some of the things beyond just, seeing sort of weight changes and body composition changes. With a lot of people with the weight management program, we find that their energy is increased. They have less fatigue throughout the day. It helps to balance blood sugar for people who are, prone to diabetes or have a family history. Certainly seen also reductions in cholesterol and heart disease risk. When you shift your weight as well, a lot of times things like joint pain and inflammation comes down. People sleep better, they have a better mood. So, we've really seen this huge ripple effect into every single system in the body. It sounds a bit cliche that, just losing a little bit of weight can change so many things, but we've really seen it happen.
Absolutely.
And losing weight in a manner that is not going to be drop 50 pounds and then put 60 back on. This is the pitfall of so many gimmick situations or fads or anything where the plan is not permanent.
And I think as frustrating as that can be sometimes, our goal is slow and steady weight loss. The slower and steadier the weight loss is, the more sustainable that's going to be for long term. So for us, healthy weight loss is between about 1 and 5 pounds per week, depending on how much weight you have to lose. And again, if it's that slow and steady weight loss, you're not going to have that yo-yo effect that so many people do struggle with.
You told me a great story about a lawyer, and I believe here in Vancouver, who adopted this plan, who had some serious health issues, and what he did for himself was pretty amazing. Let's talk about that one.
Yeah, he's like my star, my star client for sure. But this person came to me. He was well over 300 pounds, and he's now lost over 100 pounds. And he's maintained that weight loss for 5 years now.
Wow.
And he's definitely a testament to a change in lifestyle. And it takes a lot of work. There's no getting around that. He put a lot of work in. But almost all of his health conditions have been completely erased now, outside of being overweight, of course. He had some cardiovascular risk factors and some other stuff going on. And yeah, a funny story is he told me he totally got sick of buying new suits every couple of months, and he came to me one time for a check-in, and he had a rope tied around his pants with about 3 inches of extra material there. So yeah, he was very successful with our weight loss program. He's definitely our star.
Absolutely.
Well, it's important to have stories, but in many cases, it may not be a matter of a large weight loss like that or a magnificent drop in the number of inches off. Some of that will happen. But, we're going to get into this body composition versus weight management and so on. It's putting yourself on that behavioral modification. Would that be a proper terminology for you change it? You are not going to go back to what you were doing before. What is it? Einstein says you can't get out of the problem with the same level of thinking that got you into the problem in the first place. And is that the revelation? Is it, do people, when they begin to immediately feel a little bit better, because I would think anything that corrects a problem behavior in diet or taking care of yourself would make that difference. Do they understand? Is it that like, oh, okay, I feel good, I can go back to doing what I'm doing now? Is that where the coaching comes in to, come on, folks, this is just stage one or week one?
Yeah, I actually think that maintaining weight loss is a more difficult process than losing the weight in the first place. So yeah, that behavior modification definitely has to come in if you want to see long-term success. If you make change and then go back to your old way of eating or living, then of course the potential for you to gain the weight back is certainly there.
And what is the scope of age for people who come in to see you? Or how young to how old?
I'd say we see everything from, probably mid to late 20s all the way up to people in their 70s and 80s. Yeah. So I'd say probably the highest concentration seems to be probably women between the ages of probably 45 and 65. Women who are sort of going through, shifts in life and also hormonal transitions. So we do seem to see a higher concentration of patients that fit that sort of category.
Well, that's interesting that you mentioned that. And it would be touchy for me to say, is it men or women who come to see you or run into more problems or more likely to come and see you, because I would fall into that gender sort of discrimination thing. But it is important, and it is a lot about hormones. And I think that that's something that we should spend a little more time with. Right now, just let you know that we're listening to Boomer Life on CL 650 and our guests from Integrative Naturopathic Medical Center in Vancouver, naturopathic physician Dr. Katie Leah, along with Kirsten McEwen, a registered holistic nutritionist, Integrative Naturopathic Medical Center, a long-standing holistic center that offers leading-edge and effective therapies in tune with the needs of today's baby boomers. We will be right back on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.